My name is Mosedi Namane. I graduated at UCT with BCHB in 1990. In that cohort, there were two of us Black African students who were first Black Africans to graduate at UCT. I remember meeting my husband, Mandla, who has now since passed on at UCT. So that's one of the fond memories that I have about UCT. And Mandla and I subsequently had a daughter, who also became a UCT alumnus. So, yeah, so it became a family affair. My first impression of UCT, particularly the health science faculty, was in 1987 when I first came to start studying medicine. And it looked like it was not a space for people like me. Okay. I was coming from upcountry. The Western Cape is different in terms of the weather, the buildings. It just reminded me about Europe, and I hadn't traveled to Europe, but it's what I saw from movies and so forth. So I felt out of place. So that's my first impression of being at UCT. It's just feeling out of place and not that I belonged. Yeah. With time, I got to accept my situation. And of course, there was a lot of support, lots of role models and lots of mentors. At the outset, I realized also that there was good education and good quality education. And I was grateful for that. It was tough, but as I was up for the challenge. UCT also, for me, provided a lot of opportunities to develop. I mean, I never actually got out of UCT. I mean, you can see at my position now. I've gone through the ranks. It was not easy, but the environment allows you and encourages you to test yourself to the limit. And I think this is why I subsequently became an associate professor. And I think it's because of that. Okay. Then the other thing is that UCT gave me space to lead also. Okay. Especially when it came to the curriculum revision, somewhere around 2005, where it was now going to be primary healthcare themed. I say it allowed me because I was one of the first people to support the development of community-based education, okay, to match what we were doing. So in many ways, UCT has been good to me. Some of my achievements have been to have international collaborations. I am a Lancet Commissioner for Osteoarthritis. I'm collaborating with Oxford University and we're doing some work we have published. Then the other thing is because my discipline is fairly new. So as one of the first people to specialize in family medicine, okay, we were tasked, to develop the discipline further. So I'm one of those people who have authored the academic textbooks of family medicine that are used, throughout the whole of Africa. And I'm also involved in writing for nurses because they are the backbone of primary health care and we work with them. At the moment, I am in a joint post. I am working for the Department of Health and Wellness as a clinical head of a facility called Vanguard Community Health Center. And I also provide outreach support to smaller surrounding communities. This is where our students are coming. That's where we've developed the community-based education side. I'm also an associate professor in the Department of Family Medicine. I've become a clinician researcher. I've built a decent, I think, research profile. And I'm a reviewer of articles that have been submitted for publications that are mostly primary care related. I'm also involved in committees that are concerning themselves with safe use of medication. Being a member of the Provincial Pharmacy and Therapeutics Committee, having been a reviewer for the National Standard Treatment Guidelines for Primary Health Care, and being in the Medicine Use Evaluation Committees. Basically, I'm in the field that is concerning itself with activities around pharmacoepidemiology. Yeah. I'm hoping for UCT to go further, to soar to even greater heights in terms of their contribution to new knowledge. However, I also am wanting UCT to reflect on its values. There are many heads that have come about because of lack of humility, lack of transparency, lack of showing gratitude, particularly to stakeholders, not being seen to negotiate in good faith, and transparency, and respect. So those are the things that I feel UCT should do something about, because it's tarnishing their reputation.